Welcome back. When it comes to Affordable Care Act, or as many people call it, Obamacare, there are no shortage of questions and confusion still. Joining us now to help us answer some of those most commonly asked questions is Vince Spinelli, a licensed agent with Health Markets. Good morning.
Good morning,
Welcome
Carly.
back. How
Great
are
to see you again. Great to see you.
Great to see you, because I know you are bringing, as I kind of call it, you're a peacemaker, I think, because there is so much confusion, there's so many questions, and people need somewhere. They want to talk to somebody in real life of who can help them, and that is where you guys step in.
Well, you're right. Just to go backwards for a second, the enrollment period ended on February 15th.
So it should be done, right?
Well, not quite. You can't kill it. And then because of the technical issues, it was extended for a week.
Okay.
And then the Friday, the 20th of February, there was a discovery that some people may be being penalized, getting penalties on their income tax that they didn't realize. So for those people that were unaware, there is a new election period that starts this Sunday, March 15th, and runs through the end of April. And that gives a tremendous opportunity for so many Americans to become enrolled in the important health care that they need. As a matter of fact, the government is estimating as much as 5 million people will be enrolled during that next 6-week period.
So I guess what are some of those questions? What do you want people to know this morning if they're watching? And again, I think the main message we want to let people know is there is help available.
Correct. Well, 80% of the people that call me have already tried to apply, and they run into the same problems. They're not sure as to how to compute their tax credit or if they're going to get one. And then when it comes to selecting plans, they get very, very confused between deductibles, coinsurance, and copays. So it really is foolish to go on your own when you can have a trained person with the tools that Health Markets provides to assist you through that process of selecting, aiding, comparing, and it's all at no cost. And
it's a really unbiased look, too, right? I mean, it's not like you have some kind of agenda where you're trying to get people to do certain things. I mean, this is kind of a, you really are in the business of helping people. At Health Markets, we represent dozens of companies. So we don't have one company to kind of urge someone to be, selecting. I know you had some stories you wanted to share this morning, some good news stories.
Yes, and well, one significant one was a cancer patient, a woman in her 50s with limited income and concerned about how she was going to get the care that she needed. Through the Affordable Care Act, I was able to assist her to get a policy for less than $50 a month.
Wow.
And her total cost out of pocket for the rest of this year are going to be $400. So she's going to have all of her cancer treatments taken care of, and her out-of-pocket is going to be less than $1,000.
And I know that was one of the main reasons, not to get into politics, but that was kind of the purpose of this.
That was what the Affordable Care Act was all about. Another one was a similar case of a woman also in her 50s, limited income, congenital heart disease. She's postponed surgery for over a year. Now she can get the surgery, and again, between a very low premium, under $70, and a deductible of $750, she'll be fully taken care of for the balance of the year.
Well, and which I think you were telling me too, one of those patients actually just saw you on our show, and that's how they knew to call.
That's what I wanted to say. It was your interview that caused both of them to call.
Yeah, well, and I think so many people don't realize that there is somebody out like Health Markets and advisors like you that are willing and eager to help.
Yeah.
So I think that's the good news this morning is, I don't care what policy you have, what insurance they're all confusing.
Correct.
So, and then when you add, the tax penalties on top of that, I think people are really searching for help.
Right. They are searching, and fortunately, because of the morning blend, I've had a number of people contact me. Those are the two most dramatic stories.
Yeah.
There are other many incidents that are a result of your interview with me.
Oh, well, we're certainly glad, not that we did any help, but certainly that's what we like, letting people know that there is help out there. So for somebody watching this morning, I think the good news is maybe you've already signed up, maybe you did it wrong or whatever. You're still willing to help and kind of talk with everybody who may need help.
Right. Everyone that missed the boat, so to speak, now has a reprieve.
Okay.
And if they want help with whether or not they qualify for a tax credit, which policies best suit them and their family situation, we can provide that help. As I say, we have the tools, we have the training, and we take the time to make sure that the client gets a proper policy before they plunge into the application.
Just not another number.
That's right. That's right.
Best thing to do, email, call, go to your website. What would you have them do?
Whatever is fine. Actually, the simplest thing is my phone number, 239-919-3028. And I take calls 24/7.
And how nice is that there's actually, a real person on the end of the line. Again, you're not just another number. Yes. Well, Vince, we love having you here. Thank you for being here. Thank you for offering this help in Southwest Florida. I know it's very much appreciated.
Thanks, Carly.
We look forward to having you back.
Thank you.
All right. Again, for more on health markets, all you have to do is head to our website, FoxMorningBlend.com.
No pain and no downtime. Up next, how Swan Centers can help you look and feel younger in no time at all.